living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
When you think about getting healthcare at home, does it take you back to years gone by when doctors showed up at a person's front door with their medical bag in hand to make a house call? Well, those days are not necessarily behind us. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Lisa Sather, your host. Today we explore home healthcare, what you need to know about home health services, and how to get them. Stay tuned. Welcome back. Today we're aiming to help you understand different types of healthcare that you can receive in your own home. Joining us first this morning is Roxanne Closey, Assistant Vice President for Clinical Services at Easter Seals Goodwill, Northern Rocky Mountain. Thanks for being here, Roxanne.
Thanks so much for having me.
So, thank you. In 2019, we really don't see doctors making house calls anymore, and so I think it's important that some people might not even know that they can get health care in their own home. Do you think that's an important aspect of what we can do in this day and age?
Well, something that we're trying to do is keep people out of the hospital. We know that it costs more money in order to have somebody in a hospital setting, even in long-term care or an assisted living facility. So what we do and what we're able to do at Easter Seals Goodwill is offer home health care services in the home, and that's basically a skilled nurse who will go to the home, especially for someone who has a really difficult time leaving their home easily. It's a big task for them to have to leave to go and see a therapist or to go and see a nurse. So what we do is we take our nurse and our therapist to them, and we go into their home and we offer the same type of care they would receive if they were in the hospital, obviously not in the same environment. So we do recognize that we are being invited into their home, their sanctuary, and we are privileged to be able to go in and care for them.
That's wonderful. So I understand there are different levels of care that a person can receive in their home, and I assume that can be confusing to people. How do they understand what that's all about?
So with anything, there are different levels of care that we can provide. At Easter Seals Goodwill, we have multiple levels of care that we can provide in the home. So if you have an individual who basically just needs someone to help them with grocery shopping, maybe preparing meals, maybe changing some bedding or light housekeeping, preparing those meals and putting them in the freezer so it's easier for someone to take out. We have personal care services, and those individuals that go into the home are personal care attendants. They receive 16 hours of training, and then they can go in and take appropriate care, whatever that level of care that individual might need. So we look at that, and then we would graduate to maybe a private duty nursing, and that then is primarily an LPN who would go in and they would set up medicines for that individual for maybe a week or 2 weeks. They might do nail care, foot care, if they need to have some help with that. If they just need their blood pressure checked, they would go in and take their blood pressure. So those are some of the basic things that we can do with our PDN or private duty nursing model. Then we would graduate to the skilled, and that's someone who has that difficulty in getting out of the home. And so we bring our nurses in to help them with wound care. Maybe they have a catheter in place and they need some help with that. Maybe they've just had surgery and they just are not very strong, and so they need to build their strength again. But they want to stay at home. They don't want to go somewhere else. And then we take it to the next level, and that would be our hospice care. And that's basically helping individuals, once they've reached the end or towards the end of life, be able to stay at home and die with dignity. So we have that complete umbrella of services we can offer.
With so many different levels of care that are available, and considering that you provide services in Montana, Utah, Idaho, and Wyoming, how do you decide which services to offer in which community?
So at this point, our clinical services, all of these services that we've been talking about, are only offered in Montana.
Okay.
So when we talk about Easter Seals Goodwill Northern Rocky Mountain, we do span the 4 states, but we have different types of programs. So we have anything from children's therapy to autism support, behavioral health, And then we have workforce development. We're a really big organization, and we have lots of other things we can talk about maybe on future shows.
Sounds good. Are there programs like yours available in other places? Are they available everywhere?
They are available. So you would want to look in your own community and see what you have in your backyard. And part of the challenge can be just being able to identify that level of care. And I know that if you wanted to call us, we would be able to help assist you with identifying the type of care that you would need or would best suit you. And if you are not in one of the communities that we serve, then you would be able to pick up the phone, and I know somebody would be willing to help.
Excellent. So we've heard of something like a grandchild potentially getting payment to be their grandparent's caregiver. Mm-hmm. Is this really possible?
It is. So with our personal care services, again, just kind of think of personal care as companion care. Mm-hmm. So that's the meal prep, shopping, bathing, light housekeeping, that kind of thing. So a big challenge in the state of Montana is we are so rural. It's difficult sometimes to find someone who would be willing to take care of someone who needs the help. Mm-hmm. But if they can identify a friend, a family member, then they can potentially be employed by Easter Seals Goodwill as a personal care attendant, and then they would be able to participate in what's called a self-directed model of care. That is that individual who needs the services is identifying who they want to take care of them, and then we go through that process.
Awesome. So we have about a minute left in this segment. Can you talk about how home health is different from personal care? Is it different?
It is different. So I like to think of personal care as more a companion care. So that's that support in the house, being able to help with bathing and that kind of stuff. When you're looking at home health care, that's skilled. You need a nurse, you need a therapist, you need that higher level of care. So they are very different.
Excellent. Well, we're going to pause for a break, so thank you, and I'm assuming you'll stay with us for a little bit longer.
I'd love to.
Wonderful. Coming up next, we're going to talk about different types of care you can get in your own home and who pays for that care. Don't go away. We'll be right back. Welcome back. Roxanne Closey with Easter Seals Goodwill is still with us, and we're talking about home health care. Thanks for staying with us, Roxanne.
My pleasure.
So how do people pay for home health? Is it expensive?
So the different levels of care have a different amount that's charged.
Okay.
So when we're looking at the home health care model, that skilled level of care, that is reimbursed by Medicare, Medicaid, the VA, private insurance. Very, very rarely do we have someone that needs to pay for it, like a private pay. So any insurance company, as long as a physician orders it and oversees the care, is paid for by insurance. When you're looking at personal care, more of that companion care, Medicaid does provide resources for individuals who qualify to receive personal care services. Now, something that's new this year is some of the Medicare Advantage plans, those additional plans that people purchase that are on Medicare, will pay for in-home care, that personal care service, to be able to have somebody help them with bathing, shopping, that kind of thing, rather than having to look outside that. And that's something that's relatively new and not everybody is aware of. We do have a fair number of folks who pay for those services privately. They just realize that they have maybe an older mom or dad who need that help, and their child works full time, so they don't have the opportunity or the availability to go and take care of them. So we offer those services as well. Another service we have in Great Falls primarily is our adult day program, and that's a social interactive program that is located at 4400 and Central Avenue, where adults who may not be safe at home alone during the day and they live with a family member or a friend can go and be supervised and participate in the games and so on. So you just kind of think of it, it is adult daycare, so it's just like a child care but only for those of us who are older than children.
That sounds great. Yeah. So you've talked about the different kinds of care professionals that are involved in home health. How's that set up and supervised?
So with our home health care, we have conditions of participation that are set by the Medicare and Medicaid regulatory body. So with those conditions of participation, we have to make sure that we have policies in place, we have protocols in place, we're overseeing the care that's provided and making sure that it's appropriate and that it's good quality. We just recently had our Department of Health and Human Services for the state of Montana audit for our home health care survey program, and it went incredibly well. They told us we had a spectacular survey.
That's good news.
Yes.
So what about hospice? I know that can be provided in the home. So what distinguishes that from the other programs?
So hospice is basically when you're looking at making someone comfortable toward the end of life. You're not expecting that person to improve or to get well. So what we need to do then is make them as comfortable and support them as best we can in their home. That is also paid for by Medicare, Medicaid, VA, private insurance, that kind of stuff too. So that's the difference. We still have nurses that go in and take care of them as well.
People have heard the terms palliative care and hospice care. Can you tell us the differences between the two?
Sure. So with palliative care, that's someone who has a chronic illness. So maybe they have heart disease that's being managed with medicine. And we don't really expect them to pass away in the next 6 months or so. We expect that as long as we continue to treat them, they'll stay probably status quo. They might kind of deteriorate a little bit, but with hospice, we don't expect that person to be here based upon their disease process for longer than 6 months. So that would be the difference.
Okay. So can palliative care also be provided at home then?
So at this point in time, that's something we're working with the government. I know that they're looking into allowing hospices to provide palliative care. That's not something that's in place at this point. Recently, there's been some publications and some rumblings that it could be coming soon. I just don't know for sure. At this point in time, the palliative care programs are affiliated with hospitals.
I think it's scary for people to think about gaps in healthcare and falling through the cracks. What can people do if they feel like they're in this situation?
If they ever have a question, just reach out and call your provider. You can talk with their nurse. You can call our office. Just call and ask the question, and don't be afraid to ask the question. There are no stupid questions. They're all very important, and we have a very complex system that we're trying to navigate in taking care of individuals in our communities.
Absolutely. When you go into people's homes, are there ever situations in which you might feel like they need more help than you're able to offer?
Absolutely, and that's one of the advantages that we have with the different services. We're able to kind of cross those lines a little bit. If we have a real big concern about an individual, we may want to get our social worker involved, even if that social worker is employed by a hospice program in Butte or in Great Falls. They can go to the home health setting and help assist that family or that patient. Sometimes we go into homes and they're just not safe, and so we need to make the call to Adult Protective Services and make sure that they're going to be okay.
We have time for just one last quick question in a couple of sentences. I'm assuming that you develop close relationships with folks in their homes. How do you train these folks so their relationships are professional and appropriate? Absolutely, and sometimes it's one of those things that could be easy to cross the line, but we have to make sure that they understand that we're there in a professional capacity and that we're going to take care of them. So when a patient decides that they want to adopt one of my nurses, then we have to say that's wonderful. We have a great relationship, but I'm here to take care of you. Wonderful. We'll hope you stay with us. We're going to take a quick break. Thanks. We still have more to talk about. Inviting people in your home to take care of you or a loved one involves a lot of trust. So how do you get home health care that's safe and right for you? Stay with us. Welcome back. When you or a loved one is critically sick, having a healthcare team come into your home to provide care sounds like a great option. But how do you know you're getting the best possible care from people you can trust? Roxanne Closey is still with us. Hi, Roxanne.
Hi.
So the word home can mean a lot of different things to different people: apartment, a nursing home, an assisted living facility. Can all of these home healthcare services go into all these situations?
So it really does depend upon the level of care that that individual requires. Let's just work backwards. So from a hospice standpoint, we can basically take care of anyone in their home or whatever their home is considered. So if it's a nursing home, if it's an assisted living facility, or even their own bricks and mortar house. So we can provide hospice services there. When it gets to home health care and those skilled nurses and therapists, those resources are available in a nursing home or a skilled nursing facility, but not necessarily available in an assisted living facility. So our nurses will go into assisted living facilities in the home health care arena, but not into a skilled nursing facility or nursing home. When it comes to personal care, they're able to assist in an assisted living facility or in their home or apartment, but not in a nursing home. So it's kind of, you have to identify what the needs are and where that person is, and then apply the appropriate resource.
Can you talk about the oversight on providers of personal care, home health, and hospice? How do we know they're being run well and caring for the people the way they should be caring for them?
So because we are reimbursed by Medicare and Medicaid, we have to be held to the standard that they hold us. We have recently had our hospice survey in Butte. It actually happened the day after Christmas. They showed up and they come unannounced.
Okay.
They were on site for 3 days and found 0 deficiencies. That's something that is not heard often. Our home health agency just had its survey the month of March, and we had a spectacular survey according to the surveyors from the state. Our personal care program just had its survey this month, and actually in April, and we had a spectacular survey. So when we can look at our outcomes and having the state individuals come who see programs across the state, it's not just, they don't just come to ours, but they go to all of them in the state. And for them to say that we're doing an outstanding job or have a spectacular survey speaks volumes. I'm very proud of my teams.
Absolutely. So knowing that everyone has to pass surveys, how does someone choose then a personal care, home health, or hospice program? Can they use that information?
So with personal care, it's basically giving the different agencies a phone call and then would pursue the one that you feel the most confident with. I'm not certain that you would be able to get someone from the state to say this one is better than this one. Basically, people have choice. With home health, you can go online and hospice as well and look at the compare data, and you can choose one that has good outcomes. I can tell you with our home health agency at this point, we are either meeting or exceeding the national benchmarks in 14 of 15 measures. So we have really done a lot to improve our quality, and our hospice measures that we have to report, we're at 100% for all of those.
That's excellent. So if someone is using one of those websites, can you give any guidance? Are they just looking at outcomes? What exactly are you looking for on those sites?
They're looking, what you would be looking for is the results of surveys that the patients or the families have filled out and then returned. So that's basically their experience, what you're hearing or what you're seeing.
Okay. So let's imagine I need home health services and I've used Home Health Compare to identify an agency that I'm interested in. What do I do next?
So look at the star rating, and Medallion Home Health in Great Falls is a 4-star out of 5 stars. So we're almost at the best rating. So that's what you would want to look at.
Excellent. So we've heard stories about people whose doctors refer them to maybe just one home health or hospice provider without necessarily encouraging them to go through that decision-making process. And is that okay?
So one of the rules, so to speak, is that we as providers, and even if we have someone on our home health service and they are referred to hospice, there's a choice. So you have a choice. If you are familiar with one hospice or another, then you can choose the one that you would like to go to. We have to give that choice as providers. So being able to just give a generic list with the different facilities that have the certain services that they're looking for is imperative. It's very important.
So what if you make a decision and you change your mind and you decide you want to go with someone else? Is that okay for folks to do?
Absolutely. If there's a reason that you want to choose another provider, then you have that right, and we will support it, regardless of us feeling bad, or obviously we don't want anyone to be unhappy. We want to make sure that we're providing the very best care possible. But sometimes personalities don't mesh, and so we support that decision.
What if someone wants to stop using services altogether?
We support that too, because it's always patient choice. Always patient choice.
What are your feelings about working in the field of healthcare provided at home? You're passionate about this, obviously.
I have the best job in the whole world. I get to be able to help my people, my managers, my PCAs, my nurses, therapists, social workers, everybody have the resources that they need in order to provide exceptional care. And I have absolutely outstanding clinicians that are going into the home and taking exceptional care of our patients.
Thank you. Thank you so much.
Thank you.
That's all the time that we have today, but thanks so much. I want to thank Roxanne for being here. We want you to stay fit, stay well, and stay healthy for life, and please join us next week. Take care.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.